Good morning, Tanya. I see you there. Hi, Barb. Tuning in. Kirsten, good morning. How's Cumberland today?
Oh, I'm not muted.
Not muted.
I have two screens, and so sometimes I look at the bigger screen because I noticed it is better for me. So if you ever think I'm like not talking to you, it's just that I'm looking at the other screen.
Yeah,
Cumberland is good. We did
that's
a
good.
little Christmas light tour with our parents last night, and yeah, it was good.
Amazing. Right on.
Yeah.
Sophia, good morning. Nice to see you. Ashley, I see your tile. Stephanie, I see your tile. So we're going to get started. There may be some more people who drop in as we get along. There you are. Hi, Ashley. Nice to see you again today. So land acknowledgement. I am in the South Okanagan of the Syilx people, where I'm ever so glad to be able to live and work and play. And I love setting a harmonious intention for a sustainable future that we can co-create together for all the people and plants and animals. So we are all strong and able to continue forward and creating a beautiful future for ourselves. So today we're going to get some hands-on practice. This is where you're going to actually get experience with some light touch techniques and breast massage. Now, my experience with breast massage is that now I do it almost every day. I put essential oils in there that have been shown to be anti-cancerous, and I help, kind of keep the circulation going, keep the lymphatics going. And I'm always amazed at how different the sensation is depending on where I'm at in my cycle or what my diet is or my stress levels. Sometimes I focus more on the musculature. Sometimes I focus more on the globe of the breast or, the areas where I want fluid to move. But I've seen some really beautiful experiences that people have had once they've started doing their own breast massage. And this is a good place to start, because when we understand what it's like to receive it, then when we're giving it to other people, we're more clear on what their experience is like of receiving it. So I've had some patients who have never done any kind of, good morning, Angela, any kind of self-massage of any description. And the only reason that they started was because they were at home wanting to do something for themselves in between their massage therapy appointments. And it's actually been extremely beneficial for people who at first, after especially cancer-related surgery, they were unable to come to terms with their body. They couldn't lay their hands on it. They couldn't look at it. It felt like they had a stranger between their collarbone and their hip bone. And when they were able to start putting their hands on their body, that was their first way of moving into self-acceptance, where they started feeling, okay, I'm not like grossed out by what this is. I'm not weirded out by it. I'm not, having this feeling of like, ugh, which sometimes they did, because they were like, this is so different from my body. This feels like I don't know how to recognize what's, on my chest now. And so with their own self massage, then they were able to start recognizing the contours of their body, what was, their new normal, and to help change the associations that they had towards their body. And as they were doing the self massage, they started to realize, oh, I can start to feel more. Those numb patches are shrinking, and that tightness that I was always experiencing is reducing, and my scar tissue is not as itchy as it was before. It feels more pliable. And then, they would keep going, and they would end up at a place where they felt like, I am okay with what's on my chest now. I'm totally fine to put my hands on it. I don't hurt when I'm in the shower anymore. I can share myself with another person and feel like I like what's here now. I'm good with it. I've come to terms with it. And self-massage was a big part of that process. So for us as massage therapists, massage is normal. But, you know, not all of us have an experience of doing self breast massage. So I just want to know, just pop in the chat, what is your experience so far with doing self breast massage? Is it something that you have ever done or that you incorporate regularly into your self-care routine? Just put a word in there. What does describe what it, or if it's foreign to you, if it's like, you know, something has just never really been a part of your life. So yeah, there's various here examples. Some are rarely, some are after surgery. That's often has, as it comes up, is in relation to surgery. Occasionally have done in the past or as needed. It's fantastic. I agree. It's so helpful. Question here from Tanya. Do you think it has to do with the self-realization almost as if an amputation? Yes, I do. And it's fair to call a mastectomy an amputation. It's exactly what it is. It's an amputation of the breast. We have a lot of compassion for people who have lost a limb, but that same understanding and empathy at the moment doesn't really exist for the breast part in the same way. So if we can understand people coming to terms with an amputation of a very significant part of their body that's really tied in with their identity of who they are, especially if they identify as a woman, it's a very quintessentially female part, then, you know, they're able to start creating a new, like, I'm going to say their mental schema of themselves changes. They're able to start creating new associations with their new body and to bring it in to their sense of who I am now, which is really important when you're going through any kind of a journey, any kind of a very significant experience. You're different afterwards. You don't feel the same. And if you can't reconcile where you are now as compared to where you were before, then your healing is really stymied. It doesn't have the capacity to move to the next level. Just pop a yes in the chat if that makes sense to you. Yeah, grand. And there's a comment here, self-massage is so helpful with breastfeeding support. It really is. And I have this wonderful example of this lady in one of our earlier programs, and she was a lactating mother. Her baby was about 6 months old, and she regularly produced less on one side than the other by about an ounce. And we did our own self breast massage for about 20 minutes. And then after that, she was able to express the same amount on the reduced side as the other side. And she was amazed. She was like, oh my gosh, now I know how to, you know, help my body produce the same volume of milk on both sides. So for her, that was very empowering. And I'm just going to put in a plug for her baby. Her baby probably liked it too. Yeah. So that's what we're going to focus on today, really, is the light touch techniques and the self breast massage. We learned a lot about science yesterday. We learned about trauma-informed care the day before. And today we're going to be putting that together so that you're, you know, executing that with your hands. But before we begin, I want to just include a very dear friend of mine who has been helping me with the mastectomy guide since its inception. She was here on the very first event, which was here at my house in Naramata. The lovely Annabelle, who is also a part of the mentorship program coming up. And she was actually my inspiration. Well, I'm not going to say my inspiration, but she was the first person that I ever knew who worked on a mastectomy patient. And I thought it was fascinating. But she was actually the person who introduced me to mastectomy work when we were in school. So I'm going to let her tell her story. And then if you have any questions or anything, feel free to interact with her.
All right. Thank you, Erin. Good morning, everyone. Okay. Well, moving on from the experience at school, it was in our term 6. Oh, actually, let me digress. Just say where I work. I've been an OMT for 12 years, just like Erin. We were in the same class. I work in Port Coquitlam in the Lower Mainland, and I just love it. I work in a multidisciplinary clinic. I treat really the general population, like a lot of us do, depending on, obviously, you know, if you're in Cumberland, you might see more mountain bikers, for example, and so on. But I am a person who works quite orthopedically most of the time. I'm quite a firm therapist, I don't consider myself a really deep tissue therapist because that just kill me long term. But yeah, so when we were in school, we had to do a case study for those of you who did the 7 terms. And I had a lady I met at one of the outreaches. And I was just working with her and found out she'd had a unilateral mastectomy, but she was a very complex case. And it was so fascinating. And she was so interesting and so on board when I asked her if she'd be my case study. So what she'd had is multiple surgeries related to her cancer. So a lumpectomy, mastectomy, lymphectomy. She also had her sternum removed because the cancer had infiltrated there. But they left the manubrium. And so you can imagine, okay, well, where are those costal ribs going to attach to? So they had to build a mesh cage in her chest wall for her mediastinum for some sort of protection. And that was really interesting. So I did some videos with her. I was just doing myofascial work. My goal was to try and improve some, I think, GH-ROM or something, just using myofascial. And she allowed me to video, and she did a diary for me. She was brilliant for me. And then when I presented to the class, which Erin was there, you know, people were like, wow. Because my videos were interesting to see the before and after effects and so on. So anyway, so that's how Erin was introduced initially. But I didn't just think of doing anything with it like she did. And she had this amazing idea and asked me to come on board to help her out with some of her in-person courses and a few online. But for my practice, I think it must be it's over 6 months now that I decided to just use one of my days for breast patients only. Because as many of us are extremely busy, we're booked up, some of us months ahead. Trying to fit in these people into your schedule is really hard to do. So I wanted to really focus on them and give them sort of more, yes, favoritism, if you want to put it like that. But I wanted to provide my Friday for them only. And I have a specific questionnaire for them that they get sent, as well as their regular clinic intake form. Erin will go into that more in the mentorship program. And I also color code on my Jane app. So I have different colors for sort of Gen Pop, different color for, say, pre and postnatal, and I have my pink color for my breast patients, or top surgery patients. And that seems to be working really well. But then what I do is on my Wednesday, so I have, you can put sort of tags on your shifts on Jane, if you use Jane. And I just state top surgery, mastectomy, breast, anything. And that's the only type of patient that I will allow on that day. And my staff know that, the front desk. And then they have to call in. So they filter the breast patients out specifically. But then on my Wednesday evening, I look to see, am I booked? Do I have more space? Then I'll open up remaining spots to the general population. So at least it gives me an opportunity to be busy on that day, completely full.
Yeah, those are great strategies. So, those are great strategies. Now let's talk about some of your patients that you've had. Have you had some particularly interesting cases? Has there been, cases where people were showing you things that you were like, how should I handle this? Let's get
yes,
dive into your experience with them.
I've had 2 ladies who've had expanders in. One of them had no problem at all, really. They were fine. But I think because she had a lot more breast space, because she was larger initially, so they weren't as uncomfortable. I had another lady who hers were really quite sore, but she's had her reconstruction now. I've been treating a fair few breast reduction and lift ladies. Interesting seeing the different scar presentations. One lady definitely more hypertrophic. I didn't believe it was keloid. It was really just going out, but it was definitely not as pretty looking as the other lady. But then again, they're not in the year, 6 months to a year. I think the surgeons say you're going to see your full result. So where the breast is fully settled, the scars have lightened more. So it's taken them a while to feel really comfortable looking at themselves in the mirror, and being comfortable with their new breasts. And I ask, do you regret it, or are you happy with the result that you did it? And there's yes and no at this point. I have one lady, lovely lady. She decided to remain flat. I think I mentioned that yesterday. And I'm mainly working with her left GH-ROM and her restrictions through her pec and her lats. And it feels very, very restricted through here for her to get that final end range in abduction and forward flexion.
Yeah.
She comes in weekly at the moment.
Nice.
One complicated case, this lady. So let's say her name's Sarah. So Sarah came in and she'd had a nipple sparing surgery. Didn't have expanders though, so they basically did the full double mastectomy and did implants on the same day, which does happen sometimes. She'd had a lump. I think she'd had a lumpectomy before. She chose not to do radiation because in her research, she did her own research. She felt that radiation put you at more risk of problems and complications in the future, more cancer. So she said, no, I'm not doing radiation to the surgeon. But she ended up with a skin infection. So her one breast was very pinkish purple, and she allowed me to send some pictures to Erin for her to look at too. But then it really got really purple and not looking very good. And she was a personal friend,
right?
Yeah,
bigger
she was a personal friend.
breast
So she
is like-
texted me. Yeah, she couldn't make her appointment because she said, I'm feeling really unwell. I don't feel good. And I said, okay. And I'm starting to have pain in my breast. And I'm like, okay, I think you should go to the hospital. Go straight to the hospital because it sounds like you've got an infection. Because she was feeling really feverish, starting to get feverish, getting stabbing pains in her breast. And it was really going red and swollen, she said. I went, go to the hospital. But she was trying to reach her surgeon and calling her backwards and forwards with me. And I'm like, go. So finally she did. And they said it was just a skin infection, thankfully. But I had a terrible feeling it was sepsis. But I didn't say that to her because we don't want to alarm them, too much. So everything's fine now. And she's actually nearly a few weeks ago, she had a revision surgery. So I've yet to see her after that sometimes they have to place more fat, into, I think she's getting a larger implant and then they do some fat grafting as well. So she had this liposuction, which wasn't very pleasant in the sides, I think, and her hips or something.
Yeah, it's really interesting, all the different changes that can happen from the surgeries.
Yeah.
So I'm wondering if you can share with people if you experience a difference working with people going through breast and chest surgery as opposed to just standard RMT. Like for yourself as a therapist, what is the difference for you in doing these two different types of treatments?
I feel I am I'm a very empathic, caring therapist with, I think, good communication skills and listening skills. But this has really made me think more on those communication listening skills. More, I'm having to be very mindful of my terminology, my wording, you know, if you're curious what stage they're at, if they don't say, you know, are you terminal? How do you go about saying these things? I don't know if it's because I'm in my 50s now, whether I feel more connected to these women, because the majority of them are in their late 40s, 50s at the moment. I had a lumpectomy myself, thankfully benign. They just really appreciate that someone knows what to do in this sensitive area, and they're not scared to touch you. You know, we're not scared to touch them and to provide support. And they all have said, "I wish I'd known about you before." For the lady who remained flat, it was her physio who told her about me, who was actually at your scar course. No, she didn't tell her about me. She realized that she was seeing me, that's right, and she was seeing the physio at the same time who attended your scar course a couple of months back. And yeah, so with networking there, that physio I think has will mention my name, because she's in the same area as me as well, and she works with a lot of breast patients. But yeah, it's just such meaningful work. I really enjoy the day because it's gentler, it's slower. It definitely challenges me because I'm known, I suppose, as more of a I get in there type of therapist, but I am a very calm. I can be very calm, believe it or not. I'm a talker, but I can zip it if required. My husband often thinks you can, but you know, I've definitely been learning more about myself and being more mindful of when to speak, when not to, changing my being more calmer and quieter and, you know, more grounded, I would say. But some of these ladies are just like, yeah, take the top off. You know, they're quite happy. They're chatting away. They're quite busy. Blah, blah, blah. But then one day I might have someone who's really in a very different mental state and needing a lot more sensitivity, I suppose, you know, and in how my communication goes. Yeah, but I'm oh, the sun is coming into my bedroom now. I'm sorry. It's finally coming in. Let me turn around. It's making me go look weird. But yeah, I really enjoy my Fridays, and when people leave the office, you can hear them at the front desk. Oh, that was so good. Thank you. You know, they really enjoy it and are really appreciative, and it makes you want to do better. You know.
Agreed.
Yeah.
Amazing. Okay, thank you so much, Annabelle. Those are really good insights into like how you work with people, the practicalities around it, your growth as a therapist, the patient's experience, and you know, different types of people that you work with. So thank you so much. That was really wonderful.
Welcome. Any questions? If anyone has any questions, I'm just going to turn my lamp here. I don't need that.
That's okay. We're gonna move on here so
Okay.
that we have some time to do our hands-on skills. Although I don't want to shut anyone down. If anyone's like, I have something to say on that, then definitely let us know what it is. And maybe it can be a part of your share today. So I'm going to go over what the shares are for today. This is our share number 3. And we want to know, what are your key takeaways about mindful breast and chest massage? And also, what more do you want to learn? What do you feel like, oh, this is piquing my interest. This would be super useful for me. This is where you're going to put it in the Facebook group so that we're all able to share in your experience. And then also, of course, you want to like and comment on 3 other people's posts so everybody gets that experience of being seen and validated. So as we're going through, just, you know, take note, anything that really sparks your interest, anything that you want to remember. This is going to be in your key takeaways for today. Now, this is something that is really interesting to learn about because mindfulness is an actual practice. Yes, there's a mindfulness of you know, just being more aware in the moment, but there is actual mindfulness practices. Mindfulness-based stress reduction is a program. It's 8 weeks long, and it's been studied more than any other mindfulness program. And I think it's because it is more structured and therefore easier to study. So what they found with people who are practicing mindfulness-based stress reduction in breast cancer patients, the following components are enhanced. Immune system functioning. Just pop a yes in the chat if you think people going through breast cancer would like to have their immune system functioning more effectively. Natural killer cell activation. This is a really important one because if cancer starts to develop, natural killer cells are first on the scene. They're like, mayday, anomaly going on here. The cell is not functioning the way that a healthy cell does. We need to attend to it. And so if people are practicing mindfulness, their natural killer cells become more effective and more able to do their job. So just pop a yes in the chat if you think this would be a useful thing for cancer patients to know that they are making a difference in their body this way. Coping strategies. This is really important. This is your ability to navigate the challenging situation that you are in. This is a lot of different appointments that you have to go to. This is very serious news. This is pressure on your relationships, affects your way of earning an income, your capacity to get up and function during the day. You know, all these things are affected through these surgeries and through the cancer treatments. So if you are able to help your patient have a better way of coping, do you think that would increase their quality of life and their ability to navigate through these very challenging circumstances? If so, just put a yes in the chat. Stress management. Of course, we talked a lot about stress management so far over the last 2 days. This is a really key component of being able to navigate very challenging situations. If you can keep your stress levels down, your sympathetic nervous system doesn't get overactivated, and then you're in a much better state to be able to cope with what is coming up. Relaxation. You know, when you're in stressful situations, being able to relax is a boon. Sometimes people forget, oh, I don't even think I can relax anymore. But mindfulness-based stress reduction has shown to improve it. And this is really important, a person's innate healing capacity. This is where their own body is able to create that healing response from the inside. So if we can help our patients create that, that would be useful for them. So if you would like to be able to help your patients with this, just pop a yes in the chat. This is something you think you would like to be able to enhance in your patient's life. Now, I love this study. This is from the HeartMath Institute. If any of you know of the HeartMath Institute, just put a yes in the chat. Brainwave entrainment and heart coherence. So the HeartMath Institute, they measure electromagnetic fields. They primarily started with the heart and measuring what different states that we're in does to the electromagnetic field of the heart. And they also did this beautiful study where they're showing if people are in a skin-to-skin situation, like massage therapy, and the giver has a caring and healing intention, then that registers in the heart's electromagnetic wave of the person who is giving the massage. So for us as massage therapists, we would be the giver. So that caring and healing intent, it registers. And at the same time, in the person who's receiving, their brain waves change to be in coherence with the heart's electromagnetic field of the giver. So the heart and the brain become into a cohesive field. And so if we're practicing mindfulness ourselves, we are in this caring and healing intent, we're very present, and this is registering in our heart's electromagnetic field, then we're having an effect in our patients' bodies where their brain waves are now registering our mindfulness, our healing intent, and therefore it's creating that reciprocal experience inside their own body. So in this way, you can help your patients increase their own mindfulness, their own awareness, and therefore their own, innate healing capacity and their ability to start healing themselves. Like, just pop a yes in the chat if you find that exciting. If that's something you're like, oh, now I know there's actually studies that are showing that what I'm doing, what I'm bringing to the table is having an effect in a way that I didn't even recognize was possible beforehand. I think this is super exciting. So we're going to do an experiential exercise. This is a way to start dropping into mindfulness. It's called 5-finger breathing. You have a diagram in your booklet about this, but I'm going to explain what it is. So to begin with, you're going to want to take your hand, whichever one is more comfortable. For me, I'm going to use my right hand. And then I'm going to take my index finger of my other hand, and I'm going to coordinate the movement of my finger with my breathing. So I'm going to start at the base of my thumb. And then as I move my finger up my thumb, I'm going to breathe in. And as I roll it over the top and down the other side, I'm going to breathe out. Breathe in as your fingers come up. Breathe out as you go down the other side. Breathing in, breathing out. Breathing in, breathing out. Breathing in, breathing out. Okay. So now we're going to do it in a very mindful way. So that's just a how-to. Okay, so I want you just to think right now about, how do you feel? Drop yourself into your body, close your eyes, feel yourself, and think of a word to describe how you feel right now. It doesn't have to be complicated, whatever comes first to mind. Now we're going to do this again, but I want you to really focus on your breathing, on being in the present moment, and on really feeling the contact between your finger of the one hand and your fingers of the other hand. So I want you just to be very in the moment and really concentrating on your breath, on the sensation in your hand and the movement of your finger up and down your opposite hand. Okay, so we're going to do it together. Place your finger at the base of your thumb and breathe in, moving up your thumb over the other side. Breathe out. Breathe in, going up your index finger over the other side. Breathe out. Continuing on, breathing in, breathing out. Breathing in, breathing out. Breathing in, breathing out. Starting again at your thumb, breathing in, breathing out. 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 One more time, slowing down. Breathing in, breathing out. 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 Now drop your hand and just spend a moment with yourself. And just choose a word for how you feel now after this short practice. And then opening your eyes and popping 2 words into the chat. 1 word to describe how you felt at the start. 1 word to describe how you felt afterwards. Grounded, calm and peaceful. Grand. Restricted prior and lighter after. Excellent, Ashley. Yeah. So this is a small practice that you can bring into your own life. If you're feeling before your breast patients that you're like, oh, I need to ground and center, or if you had a patient that you're feeling a little bit, out of sorts afterwards, this is a practice that you can do. You can bring it into anywhere that you are. It's really easy, and you just create that space for yourself to become more mindful and to tune in. So here's a few more comments here. Tanya says flighty to a little more centered. Kirsten says twisted and then unraveling. And Barb says cold to puddleish. That's cute. So this is a good way to kind of transition from, a busy mind into a calmer mind. And then once you're in this state, then we want to start thinking about how are we transmitting our healing intention through our hands. Now, first of all, we're going to have an experience of mindful touch, and then we're going to do the opposite, just to be able to contrast. So first of all, bring your hands together. Rub your palms together. So you're creating some heat, some stimulation, some energy between your palms. And then again, bring yourself into your more mindful state that we just cultivated, closing your eyes, focusing on your breathing, focusing on the sensation in your palms and your fingers, the warmth between your hands. And then I want you to tune into your heart. And from your heart, I want you to just feel a very caring and healing intention where you are radiating this belief in your capacity to heal, your ability to get over hard things, your ability to regenerate, and to be very supportive of yourself, feeling that you're there for yourself. And I want you to radiate this intention from your heart out through your arms and into your hands. Do you notice a change in the warmth of your hands? As you radiate this intention, is there a change in the quality of energy between your hands? Now, in a very mindful, careful way, I want you to put your hands on your chest, allowing this healing intent to come through your hands and into your body. Feeling the warmth of your hands, feeling the gentleness, the care in your hands. Allow your body to pick it up. And then slowly start moving your hands around your chest and shoulders, your neck, your head, your face, just moving in whatever pattern feels natural and good. Keeping this very healing intent in your hands, touching yourself with care, with that belief in resiliency, in your capacity to regenerate. And then go down your body towards your abdomen, your lower ribs, keeping the same healing intent, being very mindful of what you're feeling, consciously radiating your care through your hands. Move your hands around to your hips, your lower back, back up the sides of your body, and then over the breast tissue itself. If you have breasts, whatever you have there, if you have chest, if you have reconstruction, whatever is there, just introducing that caring and mindful touch to the breast area. Okay, and then just let your hands rest and absorb that feeling. Become very aware of what you're feeling. And just think of a describing word. How would you describe this feeling? And just keep that in your mind. All right, open your eyes. Shake out your hands. Shake, 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 shake. Get rid of all that mindful intention. Shake it all out. And then I want you to think about an experience you had recently that was, maybe it was annoying. Maybe it was something that you just found yourself ruminating over, was something that was going round and round in your mind. I want you to think about that experience. And then as you're thinking about that, I want you to start putting your hands on your body, following the same pathway or wherever, just putting your hands on your body, thinking about that experience, and just putting your hands around your abdomen, your torso, your breasts, thinking about this other experience at the same time. Okay, shake it off, shake, shake, shake. Feel how you feel now. And then contrast what you felt after the mindful touch with what you feel now with the unmindful touch. And what's the difference? Put your describing words into the chat. Serene versus disconnected. Those are great describing words. Healing and loved versus disconnected. Yeah. Calm and then more hasty and firmer touch. Yeah, for sure. So you can imagine if someone is coming in this, traumatized state, having gone through something, they're in a vulnerable state, they're allowing you to work in a vulnerable area, and then you're doing it with not a very mindful touch, half your mind is somewhere else. Their experience of your treatment might be very different. What do you think that would do to the safety and trust factor between yourselves? Just pop a word in the chat. How would that impact their feeling of safety and trust with you if you were approaching them in a not very mindful way? Yeah. Disconnected, unsafe. Yeah. Increased anxiety, scared or unseen. Yeah, these are great describing words. So we want to give our patient an experience of safety, of trust. So you can see now, pop a yes in the chat, if how cultivating a mindful approach within ourselves helps create that safety and trust and mindfulness within the patient's own body. Does that make sense to you? Yeah, grand. Okay, so let's go into another exercise. So I want you to just take note of your shoulder position. How are they sitting right now? And if you want to look into the camera so you can see what you're seeing there, that's great. Now, yesterday we talked about mechanoreceptors and how effective they are for light touch treatment. And one of the best treatments that I know is GTO release. So this is not complicated at all, but it's really effective, especially thinking about, people who are ultra sensitive on their chest. You want to be able to reduce the amount of tension in pec major without actually reefing on the muscle belly itself. So this is a good way of doing it. So you're going to take your 2 fingers and you're going to create these little hashtags, slow hashtags. So you're going to go down, over, up. So you're creating a little hashtag and you're going to choose only one side to work on. So choose your left or your right pec major. And you're going to choose the side of the sternum that corresponds with that muscle itself. So you're going to be on the side of your tendon, the lateral side of your sternum, and you're going to start up where your collarbone and your manubrium meet. And you're going to do your little hashtags, creating 4 directions of movement. And you're going to go down and follow the tendon to where it meets at your abdominal aponeurosis. So underneath where the breast or chest is, the tissue there, down towards your superior abdomen. Creating your little hashtags. And you'll notice this is not much pressure for your fingers. You may not even be blanching in your fingertips. You're working your way down. If you're wearing a bra, you just want to lift up your bra from the underside so that you can actually attend to the tendons. Creating your little hashtags. And when you get down to the bottom, then come back up, heading your way back towards your collarbone, creating your little hashtags, moving up, up, down, down, across, 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 across. Sticking to the one side of the sternum only. Working your way back up towards your collarbone. Up, up, over, 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 down, down. Doesn't really matter which order, as long as you're creating your little hashtag symbol. You may notice some areas are more tender than others. And then when you get up to your collarbone, then you're going to go along your collarbone on the clavicular head of pec major. Just on the underside of the clavicle. And you may notice there's different sensations here than where it was on your sternum. And you're going to go over to kind of the hollow of your collarbone close to where pec minor starts. And then you're going to work your way back towards the sternum. Because at that point, pec major starts to head off towards its creating a tendon that it will attach to your humerus. Creating your little hashtags. And then when you get to the junction between your clavicle and your sternum, just lower your hands and feel the difference between the one side and the other. Take a moment to tune in to what you're feeling. Does it feel different from the side you worked on to the side that had no attention? And then look at your shoulders in the camera. Are they at a different height than they were before? I can see this is the side I did not work on, it's higher. This is the side I did work on, it's lower. So even just those small movements, attending to just the tendinous attachments in two areas, created this change in my position of my shoulder girdle. Okay, so just pops a word in the chat that describes what you feel on the side that you did your GTO release on. Working with the mechanoreceptors, light touch treatment, just working on the tendons. Yeah, Ashley says lowered shoulder and less tension. Kirsten says more breathing room. Annabelle says relaxed. Angela says heavy. Sophia says warmth and release on the left side, parent restriction on the right. So sometimes we don't even know the amount of tension that we're carrying. Now, if this was the style of treatment that you were doing, do you think that this would play into your longevity as a therapist? Do you think that this is less work on your hands? Just pop a yes in the chat if you think techniques like this are good hand savers. Yeah, and they will help you overcome any kind of chronic pain. Chances of them contributing to arthritis in your hands are pretty slender because you're not reefing on anything. This is very light touch. It's minimalist, but it's effective. So this travels in the less is more approach, which is all about how we do things at MG. Tanya asks, with introducing breast massage, would you initially offer techniques like this as through the draping? I don't know that it's as effective through the draping, but you certainly could do this as an introduction and create draping that goes kind of, you know, like the evening gown just comes down. So the breasts are covered, but the sternum is exposed. You could start with treatments like this, explain to them what you're doing and why. And that way they won't be wondering like, this is not like a massage I'm used to. This is very minimalist. Like, are you doing anything? Are you not doing anything? I don't know. If you explain to them what you're doing and why, then usually they're pretty receptive. And for people who are a bit nervous, sometimes they are coming into breast work. They're like, is this going to hurt? I don't want anything really intense in this area. And then you can start with things like this to help build that trust and let them know you're not about to hurt them. Okay, so now we're going to get into our self breast massage. And you're going to be watching a video as you do it along. And I want you to do it with that very mindful intention in your hands. And I want you to be very conscious of massaging your breast only on the one side, the same side that you did the GTO release on. And I'm just giving you some warm up. Your camera's going to be off for this. You're going to want a lotion or an oil so that you have some lubrication because we're focusing on circulatory techniques here. And I want you to be approaching the massage in this very mindful way with your caring and healing intent and, you know, very aware of what you're doing, aware of what you're feeling, and, you know, just giving yourself that experience. Excuse me. So in the video, it was my first time filming. It's not perfect. You have to give yourself permission to, you know, start where you're at and develop. So it's a little bit faster than I would normally do. but I was a bit nervous because I'd never filmed myself massaging before. And so I was a little bit like more brisk with my movements than I would be in a normal treatment. So for yourself, you can just make sure you're nice and slow like you would be in an actual treatment. Okay. So you're going to want to be in a place where you have some privacy to do this. You're going to want to get your lotion and then undrape, either remove your garments altogether or remove, just the part that you're going to be working on. So if you want to keep one side with your shirt on, that's fine, but you want the other side to be undraped. So I'm going to give you a minute to get your lubricant of choice, lotion or oil, to set yourself up in your private place, and then to turn your camera off, but keep your volume on and your screen available, because you're going to be watching the video and doing it alongside the video. Does that make sense? Yeah, just pop a yes in the chat if that is clear for you. Yes, yes. Okay. Terrific. So I'm going to give yourself a moment. And then when you're ready, pop a ready or an R in the chat, and that will let us know you're ready to start. And then I'm going to play the video. So camera off, but screen where you can see it. And getting your massage lotion or oil of choice. Grand. Some people are ready, so we're just gonna wait for the others so that we can all start at the same time. So those of you who are ready, just start tuning into your mindful intention, rubbing, if you want to rub your palms together like we did, to create some energy and movement in your hands, creating some warmth, and then just tuning into your caring and healing intention for yourself, that you can regenerate, you can heal, that your body is able to meet you in this beautiful healing space. And there's a little example of undraping at the start of this video. And it's about 7 minutes or so that we're going to be doing this. So you're working on the same side that you did your GTO release on. So we're going to undrape. In this lesson, we're focusing on the circulatory techniques. So first, just tuck the sheet under the shoulder, ulnar border to the sternum, get permission to undrape. Is it okay to undrape? Okay, so then fold the sheet down, and then I've got the whole sternum to the ribs exposed. So we're focusing here on helping increase the venous flow, arterial flow, promoting the revascularization of the area. And if your patient has a side that has not been surgicalized, it's just as nature gave them, then you can be doing healthy breast massage on the side that they are unaffected on. Okay. So we're just starting with some nice gentle sweeping, warming the area up.
up over the shoulder and the neck, down the arm, going over the breast. So we start first on the breast, the ribs, the side of the body, before actually going in and working on the globe of the breast. Okay. Now, when you're starting to do some scooping, you're going to do this pincer grasp, and you want to just come from opposite sides of the breast. So you're down below or up above, or you're medial and lateral, and just starting to move the breast tissue around. The pressure is not that deep right now. I'm just focusing on increasing the circulation, creating an open channel through the blood vessels, warming the area up, and enjoying the freedom of not working around sheets or chest drapes or anything like that. Okay, now I'm gonna do, starting on my little bit of deeper work around the clavicle, some fingertip kneading, feeling in through this divot in the lateral chest where the pec minor comes through, starting to think about improving the vascularization of the area. And go the lateral border of pec major. Work your way down to the obliques. And around to serratus. Just doing a little bit of deeper kneading. Aware that on the side body here can be super tender for people. Now, if somebody has really large pendulous breasts, they might be hanging down all the way over here, in which case you would just come down from the lateral side, scoop up, and then hold the breast tissue more medially, and then work your way here along the side of the body, holding the rest of that breast tissue out of the way. Okay, now some areas that are important to think about clearing: this inframammary fold region here. This area here can get very clogged and tender. The lymph nodes that come down through here, they often just aren't able to drain very effectively. So helping this area, as long as they don't have lymph nodes removed, or maybe just one or two in the axillary region, you can help it to drain out the side of the breast and then up towards the axilla. Okay. When people wear underwires a lot, this area can get super, super tender, and often they can't take very much pressure here. So you just want to think about the direction of the lymphatic flow and just help the breast drain. This is not really lymph drainage per se, but you're just thinking about the direction that the lymph drains and then working with it in your circulatory techniques here. Okay, you can go from the nipple medial, so starting to do some drainage this way. And helping the fluid to move up towards the clavicle here. Okay. So you're just thinking about opening the channels of the breast. They spend so much time pinned into bras and tight clothing, and they don't really get a chance to move and shake the way that nature intended. So the fluids can get really stagnant in there. So you want to help move the fluid and just clear the area so that it can be nice and refreshed. Okay. Now, if you want to do some picking up, you're going to be making an L shape with your hands and then actually going on either side of the breast and literally like picking it up and then scooping away. Okay, picking up, scooping away, picking up. So you're creating some space. Theoretically, it's not literal, but you're sort of decompressing the retromammary space along the chest wall and thinking about creating a vacuum that the fluid can rush into and flush clear. Okay, you can also go from superior and inferior, picking up and then sweeping away. Picking up, sweeping away. Okay, a really nice way to sweep around the globe of the breast is to lift up the arm, just squeeze in front of you like this. So you're holding the elbow in your hand with your fingers on the outside, your thumb is on the inside, and you're just supporting the arm this way. If you want to move it, it makes it really easy. You got full control over the arm. Okay, some food for thought there for when you're working with a patient and you want to access the arm. So just take a moment now to tune into how you're feeling. Feel yourself. Feel the difference on the side that you worked on versus the side that you didn't. Noticing any changes in your body. And then putting your garments back on. Just wiping your hands down. Hopefully you have a towel or something there. And then coming back into the main room, turning your camera back on and letting us hear about your experience. If anybody wants to put their voice into the circle, you can just raise your hand and we can share about what your experience was like. Yeah, Sophia, come on up.
Hey, well, I'm supposed to be getting my period in probably the next few days. So lots of congestion, lots of tender spots, especially in the lymph nodes on the side. So always very tender for me. When we did breast massage in school, I let one of the gentlemen in our class practice on myself because he was a little nervous with everyone else, and I'm pretty open. And it was one thing I noticed was he wasn't really paying much attention to how much pressure he was using. And I was also in the middle of my cycle at that point. So lots of breast tenderness, lots of breast congestion. And he had my arm up and he was working very deep in here. And I had to just say, hey, you need to relax. You need to pay attention. And so when I do breast massage, this is an area I'm very sensitive with. I'm very light pressured. So even when I'm working with myself, and today I can feel like my right breast very tender in here still. Left breast feels a lot better. It feels more freeing, not as congested. It's lovely. I really love breast massage.
Amazing. That's so great. And wonderful also that you have this experience of receiving breast massage from a man, because sometimes men are like, oh, I don't know if I want to do that work. You know, they're frightened of all the repercussions that could come if not done well. So thank you for volunteering yourself for that and for sharing with us about what your experience was like. Amazing. Thank you, Sophia. Okay, Annabelle, let's get you up here.
Right, yes. Now I cheated a bit because I have done your 3-day thing before. So I actually know what it felt like for just one, felt much lighter. So I decided to do both.
Annabelle Danchuk.
I admitted it. So But one thing I did notice when you were going around the underwire, because I wear underwires a fair bit, very well fitted bras, but man, was it sore along that rib area. And, you know, I was working towards my axilla. I've had one, which side was it? Actually, yeah, it was actually this side, I think. Anyway, I've had a lymphectomy, but they only took one. So there's nothing really. But yeah, that was really interesting. And I wish just the feeling of breast massage, you just feel so decompressed. And I wish in the Western culture, it was more common. You know, my friend who went to Asia, she went to Malaysia once, and the women just whip your tops off, and she was like, "What are you doing?" But she said, but it was just common there, and just started working her breast, and she said, "Oh my God, it was amazing." So if it's just, how do you, would you, in our practice as RMTs, how would you go about mentioning that to our general, you know, population who have breast tissue? I'm not going to say cis women, it could be with breast tissue, anyone that presents with breast tissue.
Yeah.
You know, without sounding, I don't know, inappropriate even to some people, because mentioning breasts and mentioning massaging breasts, they just think, oh, no, that's weird.
Why are you mentioning that?
Yes.
Yeah,
Yeah.
yeah. But that's
Just
part
not-
of what we're doing here at MG and everybody who's involved with this, because we're normalizing that process so that it's in North America, especially, it's as normal to get breast massage as it is in Asia, where they're like, this is a fine part of the body to work on. And over here, we're like, oh, I don't know, this is very like scary. And are you going to be hurting me? And, you know, litigious. So yeah, it's a area of care that needs to be normalized for sure.
may I just quickly, very, very quickly, I'm always really curious, and I don't know if there's any studies, who knows? I'm just going to throw it out there. It's just a thought.
Throw it out there.
But if we had more breast massage as a general, just day-to-day thing, would it have any bearing in the amount of breast cancer that appears in
That is
the
a really-
in the demographic, in the statistics?
It's a
I
really
don't know. Is it something stagnant? Is this, you know, or is it just simply a DNA something, you know, it's just your cells have just gone, you know.
I don't have studies to back this up, but in my opinion, I think if we were able to do breast massage as preventative care from early in our lives, especially, that the amount of breast cancer would go down for a few different reasons. One, massage is good for overcoming inflammatory responses in the body, and inflammation is one of the red flags for cancer starting. It's able to create a cleaner, healthier environment, which is advantageous to, you know, preventative care. It's able to help reduce any kind of like localized heat to an area. It's able to create healthy blood flow. It creates an oxygenated environment. Cancer doesn't like oxygen. Cancer likes a deoxygenated environment. It's more like anaerobic. And so if we create an oxygenated environment, I think chances of cancer happening are reduced. Also, it can help you overcome trauma. And a lot of people carry emotional trauma in their chest, in their heart. And I think women collectively carry trauma in our breasts. I think that's one of the reasons why breasts are unhappy these days, because women have given birth to pretty much everybody, unless they were artificially born in a lab. They've come from a woman's environment, a woman's body. And so women are connected to everybody on the planet, and the planet is suffering. And I think women are carrying that in our breast tissue. And so if we're able to provide that care and that support, then that collective healing will also happen. And I think all of that reduces the likelihood of cancer forming in an environment. So it's my personal opinion, but I think it's an educated one. And I think it's got a good chance of offering that preventative medicine against cancer forming. Yeah.
Tanya had
Wonderful
some
if we
good
could get some
points to
studies
make.
that would back that up.
Right.
So great.
Yeah. Tanya's made some good points on the.
Yeah. Grief is held in the lungs and chest too. Absolutely. Traditional Chinese medicine recognizes that the lungs hold grief. And, you know, the lungs, the heart, the breasts, like all of it is close together. There's no way that they're not affecting each other. And, you know, if we're able to mindfully work with these areas, then, you know, we're creating that opportunity for deep healing in the body. Here's another comment from Barb. Puberty hits and some folks start hiding their curves. Yeah, they sure do, especially if they're developing breast tissue before they're mentally ready to accept the attention that breasts bring. Like there's some girls at 11, 9 who are already at like a B or a C cup. And then by the time they get to be, you know, 16, they're D's, double D's, and they're like, oh my gosh, I'm not ready for all this attention. And so they'll, you know, hunch forward, they'll hide, they'll wear baggy clothes, and they'll have associations with their breasts, which are not that favorable. So I would love to see women, as they're turning from girls into women, women mentoring girls to be able to have healthy breast care right from the beginning. Like imagine the change that we would have with our bodies, the lack of shame that we would carry, that feeling of like, oh, I'm proud of my body. I feel autonomous with my body. I'm able to interact with it in a healthy way and able to provide care. And, you know, I can talk about it with other people. And if they're mentored with the women, then like our whole relationship with our body and our female parts could be extremely different from what it is right now. So I think by doing this work, we're contributing to a revolution in healthcare and associations with women's bodies. Like we can absolutely transform how we relate to a very significant part of women's bodies. And it's another reason why I'm so passionate about this work, because women are evolving. We need to evolve with it and be a part of the solution. Okay, that is so exciting. So we've had 3 days together. Today, we covered the science of mindfulness, how when we as givers are able to be in a very caring and healing state, that can be measured in our heart's electromagnetic field. And if we're in skin to skin contact with another person at that time, then those changes in our heart's electromagnetic field get registered in the receiver's mental field, in their brain waves, and then the two come into coherence with each other so that we're able to help our patients come into a more mindful state themselves when we are in a mindful state ourselves. So this is why it's so important, especially doing breast and chest care, to be in this mindful state. And it creates trust. It helps people overcome trauma. And you can see when you're putting your anatomy together and all the different things together, light touch treatments, that it creates this beautiful, meaningful, sustainable practice that can, you know, you can do for years on end. Like chances of you burning out as a massage therapist, if you're doing this work, are very slender. So let's tune into your share number 3 again today. Key takeaways: mindful breast and chest massage. So right now, just pop a word in the chat that would describe your key takeaway from mindful breast and chest massage. And then you're going to want to put this post up in the Facebook group so other people can share along with you. What would be a word that would describe your key takeaway from mindful breast and chest massage? Being present. Yeah, that's a really good way of describing it. Power of intention. Love it. Yeah. Treating with a healing intention, right? It's powerful. It really can make some changes. Barb says, I miss my right hand. That's funny. Uplifting, no pun intended. It's true though. It's very, you know, it's like an elevating experience. And I would love for you to be a part of that. So your second key takeaway is to share what more you want to learn. because this is an area that is very new, it's very progressive, and for you, it may be a new area of your practice, and your curiosity may have been, you know, lit up. So we also want to know what more you want to learn. Now I'm going to just give you this opportunity again, remind you, I'm inviting you to start your one-on-one mentorship right away with a clarity call, so that you can understand where you're at now, where you want to be, and steps you can take to move forward towards creating a sustainable and meaningful practice. So Marielle has put the link in there for the clarity call. I know some of you have booked already, which is great. I'm really looking forward to seeing you there. And I really hope that you enjoyed yourself over these past 3 days. I have loved being with you and sharing this space with you. I always love to introduce people to the concepts, you know, deepen their learning, give them thoughts about where they can go in the future. So if you were inspired at all, if you feel like this is something you could see yourself doing, this is a way you could see yourself contributing to the world, I will invite you to join us and book your clarity call and put your share up in the Facebook group. That is all, my friends. I will see you soon. Thank you so much for your time and attention.
Lovely to see you, ladies, and anyone else who's there that I don't see right now.
Amazing. So
Thank you.
lovely to see you.
Thank you so much.
Thank you.
Thank you, Sophia.
Bye.
Bye.